yesterday in Pennsylvania because people got vaccinated. They got vaccinated. They don't need a mask when the vast majority of people got vaccinated. Look, I want to talk about what's really happening, what it means, what it doesn't mean, and what we need to do this week and the months ahead. From the moment I was elected, I said I'd always give it to you straight from the shoulder. And we need some straight talk right now. Because there's a lot of fear and misinformation in the country. And we need to cut through it with facts, with science, with the truth. So, what's really happening today? After months and months of cases going down, we're seeing a spike in COVID cases. They're going up. Why? Because of this new form, this new variant called the Delta variant. This is a much different variant than the one we dealt with previously. It's highly transmissible, and it's causing a new wave of cases in those who are not vaccinated. Our experts tell me that cases will go up further before they start to come back down. But while cases are on the rise, we're not likely to see, according to experts, a comparable rise in hospitalizations or deaths in most areas of the country. So you have to ask yourself, why is that? Because 164 million Americans are fully vaccinated, including 80% of the most vulnerable, our seniors. So there's a challenge, as you knew there could be. But there's also good news. We've spent the last 6 months preparing for this possibility. The vaccines are highly effective. We have enough vaccine for everyone to get vaccinated. And thanks to the American Rescue Plan and the hard work of the American people, we've administered over 325 million vaccinations doses in the past 6 months. We have the tools to prevent this new wave of COVID from shutting down our businesses, our schools, our society, as we saw happen last year. I've said from the beginning that we will be guided by the science. So here's what the science tells us. On Tuesday, the Center for Disease Control and Prevention, the CDC, announced its new mask recommendation in parts of the country where COVID cases are substantially high, where people didn't get vaccinated, which they define as 50 new cases for every 100,000 people in a week. The CDC recommends you wear a mask when you're in public and indoors, like work or in a grocery store. That's true for both the vaccinated and the unvaccinated. Why? Because even if you've been fully vaccinated and protected from severe illness from COVID-19, you could have the Delta variant in your system and spread it to someone who isn't vaccinated. We need to wear a mask to protect each other and to stop the rapid spread of this virus as we work to get more people vaccinated. And I hope all Americans who live in areas with substantial or high case rates will follow the mask guidance that's being laid down by the CDC. I certainly will, and I have, because this is one of those areas in Washington. And at my decision, at my direction, all federal personnel and visitors to federal buildings will have to do the same thing. As I said from the beginning, a mask is not a political statement. It's about protecting yourself and protecting others.